Welcome back to the deep dive. If you follow the world of digital health, it's exploding. So much happening.
It really is. Almost hard to keep up sometimes.
Exactly. So today we're going to try and cut through some of that noise. We've got a stack of recent sources, and we'll pull out the really impactful stuff.
Sounds good.
And this is actually our 17th deep dive for weekly digital health from White Coat Hackers Media. Our goal, like always, is really to break down these complex advances,
Yeah.
make them make sense for you. We're not just reading headlines. We want to get into the why and the how behind these breakthroughs.
Right. The context is key.
Totally. So today we're looking at, well, three big areas. First, these things called digital twins popping up in health.
Fascinating concept.
Yeah. Then how some pretty cutting-edge AI is changing the back end of healthcare operations, streamlining things.
It's needed.
And finally, something really crucial, how AI is actually speeding up research for diseases like Alzheimer's.
A huge challenge,
Yeah.
obviously.
So yeah, the goal is to give you a shortcut, really. Get you informed, give you some practical takeaways, maybe some details that stick.
And it's a great snapshot these sources provide, where things are really heading.
Definitely.
What's really striking is that these aren't just ideas floating around. They're getting serious money behind them. They're scaling, making a real impact already.
Right. Not just lab experiments.
Exactly. So we'll dig into the tech, sure, but also the strategy behind it all, how it's actually going to change things for patients, for efficiency, the whole healthcare picture.
Okay, perfect. Let's jump right in then. This first one is, well, it feels pretty transformative. Digital twins. We've heard about them in engineering, maybe manufacturing, right? But now they're moving into our health. Personally.
It's a big leap.
Yeah. So Twin Health, this startup, just landed another $53 million in funding. They're getting close to $1 billion valuation.
Wow.
And what they do is use this digital twin tech specifically for metabolic health, trying to improve that.
A huge area of need. Diabetes, obesity.
Exactly. And their strategy seems to be partnering up with health plans, employers, getting it out there.
Makes sense. Broad adoption is the goal.
But here's the thing. What is a digital twin, really, in this health context? And why now? What's the tech leap that makes it, viable for me or you? Is it just better data collection?
That's a great question. It's way more than just collecting data points. The real shift, the game changer, is integrating all sorts of data genomics, wearables, EHRs, lifestyle stuff into one dynamic model.
Dynamic how?
Well, it's not static. It's constantly updating, learning, simulating your specific physiology. It predicts how you might react to things. Think of it less like a dashboard, more like a living virtual you.
Okay, like a simulation.
Exactly, a personalized simulator. And Twin Health's funding journey really highlights the belief in this potential. This $53 million comes after $50 million last year, and $140 million in their Series C before that.
So consistent big bets.
Right, strong validation from the market.
Right.
But they're not the only ones playing in this space. It's broader than just metabolic health.
Oh, like who else?
Well, look at Teton, based in Denmark. They've developed an AI companion for nurses.
Okay, what do they do?
It monitors patients, helps optimize the nurse's workflow, spots risks earlier. They even created this real-time 3D reconstruction of a hospital room using Denmark's national supercomputer.
A 3D model of the room. Why?
It's not just visual. It processes tons of real-time data from the patient, the equipment to build this dynamic virtual environment that can predict risks like falls or pressure sores way more accurately, and it cuts down on paperwork.
Okay. So it's a prediction and workflow.
Precisely. Then you've got Unlearn. They're using digital twins for clinical trials.
How does that work?
They use machine learning to create digital twins of participants before they're even randomized into groups.
Before. So virtual patients.
Sorta. The idea is to model what would likely happen to someone if they were in the control group based on their twin. This gives researchers insights without needing such large placebo arms.
Which means faster trials, smaller trials.
Exactly. Smaller, faster trials. Which should shave years off getting new drugs approved. It's a big deal. Unlearn's raised over $130 million total, including a $50 million Series C last year.
Wow.
So if you connect the dots, digital twins promise really personalized, proactive care on one hand and much more efficient research on the other.
So for the listener, for you, this could mean health advice truly tailored to your body. and maybe faster access to new medicines down the line.
That's the potential, yes.
That's pretty compelling. Okay, so that's the personal side. But what about the machinery? The healthcare system itself could be so clunky.
I'll wrap to you.
Our sources show AI is diving into one of the biggest headaches there. Prior authorization.
Ugh, don't get me started.
Right. Anyone who's dealt with it knows the pain. So this company, Develop Health, just raised $14.3 million Series A. Totals about $17.6 million now.
Okay.
And what they're doing is building a platform integrated with the electronic health record, the EHR, using generative AI specifically for getting medications approved.
Generative AI. Interesting.
Yeah. So it handles insurance verification, puts together the prior authorization packages, submits them, the whole 9 yards.
Automating that mess.
Right. And they plan to use the money to integrate with more EHRs, more PBMs, pharmacy benefit managers, expand access, and also help companies navigate that tricky space between pharmacy benefits and medical benefits.
That's complex territory.
So the question is, generative AI. That sounds like more than just basic automation. How is it really changing the game for prior auth? Not just speeding up the old painful process.
Yeah, that's the key difference. Prior auth is this massive administrative sinkhole, right? It causes delays, patients don't get meds. It's a real barrier.
Totally.
What's transformative about using generative AI here is that it's not just filling forms faster, it's learning the different rules for every single insurance payer. It anticipates what they'll need.
Okay. So it's predictive.
Exactly. It gathers all the necessary clinical notes, the justification, and it essentially builds the perfect submission package automatically, tailored for that specific request, a specific payer.
Reducing the back and forth, the denials.
Precisely. It tackles the complex decision-making and documentation burden. Develop Health is right on that pulse. And like with digital twins, they're not alone.
Who else is in this space?
Well, there's Foundation Health. They do AI automation, but also telehealth, diagnostics, pharmacy tools, kind of a broader suite.
Okay.
They got $6 million in seed funding last year. And they're actually running a pilot program, 6 months, with Intermountain Health's specialty pharmacy.
Oh, yeah. Doing what?
Using their AI platform called PIGE specifically to automate patient outreach and communication, trying to free up the pharmacy staff.
Makes sense. Then there's Cohere Health. Heard of them?
Yes, another big player focused squarely on prior authorization automation. They just got another $50 million in equity funding back in February.
$50 million. Wow.
Yeah, brings their total funding to $106 million. And their growth has been fast. They raised $36 million Series B in 2021, less than a year after launching. Shows you the demand.
Absolutely huge demand for fixing this.
So for you listening, what this really boils down to, it's not just about saving hospitals money on paperwork, though it does that.
Right.
It's about cutting down that frustrating wait time, getting you or someone you know the medication you need when you need it, without jumping through endless hoops.
Getting rid of that phone tag and fax machine nightmare.
Hopefully. That's the goal, making that whole experience less of a relic.
That would genuinely change lives.
Okay, so we've gone from personal digital twins to fixing systemic bottlenecks. Let's shift now to, well, a really big challenge, Alzheimer's disease.
A critical area.
Our sources point to a major push here involving AI at, like, the highest levels. Bill Gates is backing an initiative.
That's right. He lost his father to Alzheimer's. It's personal for him.
Yeah. So he and other partners through the Alzheimer's Disease Data Initiative,
Right.
the AD Data Initiative, they're offering a $1 million prize.
A prize for what specifically?
For agentic AI Alzheimer's research, they've got rolling deadlines for applications going all the way into 2026. Okay, agentic AI. What does that mean in this context? How is that different from, regular AI analyzing data? Why is that the focus for something as complex as Alzheimer's?
Good question.
Certainly. So agentic AI isn't just about pattern recognition in existing data. It refers to AI systems that can act more autonomously. They can plan, they can reason, they can execute complex task sequences. Think of it like an AI research assistant or even a co-pilot.
So it could propose experiments.
Potentially, yes.
Yeah.
It could formulate novel hypotheses based on the data, maybe design virtual experiments, or even help iterate on potential drug designs in a much more self-directed way. It accelerates the process of discovery, not just the analysis.
Got it. More proactive.
Exactly. And the whole strategy of the AD Data Initiative is built around this idea of accelerating progress through collaboration and, crucially, data sharing.
Data sharing is often a hurdle in research.
A huge one. So a core piece of their work is the AD Workbench. It's a secure cloud platform where researchers worldwide can share, access, and analyze Alzheimer's data. And it's free for them to use.
That's significant.
It is. It's designed to work with other major platforms too, like Answer ALS, Dementia's Platform UK, HDR UK, making data genuinely useful across different studies.
So, breaking down silos.
That's the goal. And they're driving specific projects too. Just in June, they announced a partnership with Alamar Biosciences and Gates Ventures,
What's that about?
generating massive proteomic data sets, looking at proteins in the blood linked to clinical outcomes. They're planning to profile over 40,000 plasma samples internationally.
40,000. Wow. For biomarker discovery.
Exactly, trying to find better ways to track the disease, understand its progression. Earlier this year, they also launched the AD Discovery Portal.
Portal.
Yeah, basically a user-friendly catalog. It helps researchers find relevant data sets available through the workbench, imaging, genetics, clinical data, you name it.
Making it easier to find the right data.
And they're also looking beyond just biology. In 2024, they started a project with AARP and the University of Washington, the Dementia Risk Reduction Project,
What's the focus there?
studying how things like air pollution, alcohol use, diabetes, hearing loss, social isolation, how these factors vary state by state and correlate with dementia rates. They want to explore actual causal links.
So connecting lifestyle and environment to risk.
Right, information for individuals, but also for policymakers. And beyond this big AD initiative umbrella, you've got other companies innovating too.
Like who?
Ilimis Therapeutics just closed a $42 million Series B. They're developing Alzheimer's drugs based on what they call GAIA, Gene and AI Integrated Approach.
GAIA. How does that work?
They use advanced bioinformatics, AI, to map gene expression patterns against disease pathways, trying to pinpoint novel drug targets that others might miss. They're even expanding into immune disorders now.
Interesting approach.
And then there's Gray Matter Neurosciences. They got $14 million seed funding in January.
What are they working on?
An ultrasound headset for Alzheimer's patients. They're in clinical trials now, testing safety and feasibility, a completely different modality.
Ultrasound.
Yeah.
Fascinating.
So, you see this combination. Large-scale, collaborative data initiatives powered by advanced agentic AI, plus specific companies tackling drug discovery and even new treatment devices.
It feels much more coordinated, comprehensive.
I think so. This multi-pronged, data-driven approach, really supercharged by AI, feels like it genuinely boosts our chances of finally making some real breakthroughs against a disease that's been incredibly tough to crack.
It offers real hope for you, for your family's future,
Oh,
tackling this head on.
absolutely.
Wow. Okay, we've covered a lot of ground today.
Yeah.
From those personal digital health twins
The personalized future.
to AI untangling those awful bureaucratic knots like prior authorization.
Making the system work better.
And finally, this really concentrated AI-fueled effort to accelerate research for Alzheimer's.
Tackling the biggest challenges.
So stepping back, what's the big picture here? What does it all mean? It really feels like technology isn't just tweaking things around the edges anymore.
No, it's more fundamental.
It feels like a reimagining of how we manage health, how care gets delivered, how we fight disease. The speed is just kind of breathtaking. The funding, the real-world application.
It is astounding. And as these solutions get more powerful, more woven into our healthcare, it does raise some interesting points, doesn't it?
Like what?
Well, think about the ecosystem that's emerging. You've got your digital twin, AI managing your approvals, AI helping find the drugs you might need. It's creating this incredibly complex, interconnected web of health technology.
Yep.
How does all that integration work? How does it transform your actual health journey day to day? It's moving towards a completely new paradigm, really. Proactive, deeply data-informed care. We need to think about what that really looks like in practice.
That's a great point. The convergence of it all. Definitely something to keep watching.
For sure.
Well, this has been incredibly insightful, a real deep dive into where digital health is heading right now.
My pleasure. Always fascinating stuff.
Thank you so much for joining us. And for everyone listening, if you found this valuable, if you want to stay ahead on medical tech, please do subscribe to the White Coat Hackers Media channel. That way you won't miss any future deep dives from Weekly Digital Health.
Definitely worth doing.
Until next time, keep learning, keep questioning, and keep exploring.